for people who are listening. One of the reliable medicines for test-taking anxiety, for performance anxiety, is a homeopathic medicine called gelsemium. And in case anyone's really paying attention, it's spelled Gelsemium, gelsemium. But gelsemium can be very useful for people who, some people freeze up when they take exams. And as a matter of fact, I'll be perfectly honest with you, I was looking for gelsemium before I came on air today. But I think I gave my tube away to my wife. When she gives presentations, she does, very important for her to not be anxious. So, but in any event, gelsemium in a dilution of about 30C, if you take 5 to 10 pellets the night before you take an exam, or the night before you have to do a stage performance, or the night before you have to go on television with you. Well, not that I'm nervous, no, because I'm quite at ease, but and then take it again the day of the exam or the performance is very, very useful medicine to take. So there's a practical thing that our viewers can
They can start right away.
Right, right.
I find that it's amazing, and like I said, you're right, it's not, wow, it works. It's more like such a gratifying feeling that I did something, I helped this patient, and the effects are pretty immediate.
Yes.
It's not like taking an antibiotic and having the patient call you 2 days later and say, I'm still not feeling well, my sinus is still hurt, and you're like, well, you know, it's a closed space, it takes a couple of days, give it 5 days, give it 7 days. It's kind of like, well, you'll be feeling better by tomorrow morning. And
the great thing about what you said before about being an integrative physician is this. There's no reason that you can't use conventional medicine and use homeopathic or any other alternative medicines in conjunction. So a good example would be mono. There are no great medicines for mono. Once in a while, physicians use steroids to shrink their tonsils and whatnot, but homeopathic medicines are very useful in mono. Strep is another great example. So without hesitation, I always use antibiotics for strep for very well-defined medical reasons. Well, as you said, some people 2 or 3 days later say they're still not feeling right, and they're on the proper antibiotic. In that situation, I will prescribe homeopathic medicine for the symptoms, and it can be used in conjunction with it. They're safe, and oftentimes provide the symptom relief that the patient needs.
Right, and that is sometimes even more important than actually getting rid of the bug, because very often it's the symptoms, the pain, the sore throat, you know, the bad headache, the sinus, want to pull your eyes out of your head, that makes them come into your office. And so very often we start them on an antibiotic, but we really haven't helped them, because they leave and they'll call and say, well, I don't feel any better, and that's the basis of what they came into the office for.
Well, physically that's the basis too. I mean, like ear infections are another good example. You know, if you take antibiotics, antibiotics kill bacteria. Unfortunately, they also kill them all over your body, including your throat and your intestine too. But they can kill bacteria in your middle ear, but the fluid remains there many times. And so you have to give medicines, or you have to do treatments that provide drainage of the fluid, as you said, in sinus infections too. And homeopathic medicines are very useful in conjunction with antibiotics in both those cases. Yeah,
sometimes it works for things you don't think of. In the course, they mentioned graphite for keloids. And I had a patient who was going to have surgery, and was really concerned when she came for her pre-op clearance about the fact that she forms keloids. So I said, well, you might want to try this. I said, I don't know if it works, but theoretically it's supposed to work for this. Wasn't even sure how soon she was supposed to start it, so I actually had her start it like 3 weeks before the actual surgery. And it was amazing, because this is a year later. She never developed the keloids.
That's really good.
Yeah, and it was. I was just flabbergasted, because that's something that you're kind of like, well, I don't know if that's going to work for this. But it did.
That's right. It's you know, that's one of the great things. The more you use it, the more experience you have, the more data you have, and I think not just the more confidence that you have in prescribing, but the confidence you have is that your patients can do better, you know, with this brand of prescribing.
Yeah, it's I've been very happy in the times that I've used it because of that. I've had a few patients that it didn't work, and it's like anything else, not every antibiotic works for everybody.
Right, exactly. Everybody's heard of arnica, okay? So in other words, a lot of people use arnica, and they, and I think it's another experiment that would be good for patients to try to satisfy themselves that there's some merit in using homeopathic medicines, and that would be after any kind of bruising, banging your leg, or getting hit with a baseball in the arm, or I get bruised a lot. Not that I'm careless, but I tend to get banged up a little bit. Yeah, So arnica is very, very useful for injuries. The one thing that people need to know is you need to take arnica by mouth. You can use the gel, you can use the cream, that's okay, but you need to take arnica by mouth pretty frequently after an injury. So I'll give you a good example. Like, for example, if I wasn't paying attention and I banged into the edge of this table with my shin, you would tend to get a bloody lump on your shin. Well, in that situation, you really should take 5 arnica pellets every 15 to 30 minutes for the first few hours until the swelling comes down. Then maybe every hour or 2 that day, then the next day every hour or 2, and then taper over 3 or 4 days. People think homeopathic medicines are a little bit different than conventional medicines in that in some cases you have to take them more frequently when there's an acute problem, and then less frequently as you improve, and then stop when you're better.
Actually, many of the plastic surgeons are using arnica when they do eyelid, so that you don't end up with that raccoon eye appearance as you're healing. And they actually give it to patients. They have these kits with vitamins and all this stuff, and arnica is one of them that they recommend that you start.
Very popular with the plastic surgeons.
With the plastic surgeons. Yes. Well, Larry, I want to tell you this has been great, and as you know, you're my first guest.
Thank you.
Many of you have seen me on another show, but now this is our show. And you can reach Larry. His credits will be on the screen shortly. And this has been great, and I'm happy to have you on the show.
Well, it's an honor to be the